The most life-threatening complication of major bleeding is hypovolemic shock. It is the intent of this station to evaluate your ability to treat progressive shock due to hemorrhage.
This is a scenario-based evaluation. As you progress through the scenario, you'll be given various signs and symptoms appropriate for the simulated patient's condition. You'll be required to manage the simulated patient based on these signs and symptoms. You can use any of the supplies and equipment we have available in the room. You have 10 minutes to complete this skill. If you would, please take a few minutes to familiarize yourself with this equipment before we begin. Do you have any questions?
No, sir.
Okay, this is your scenario. You respond to a stabbing and find a 25-year-old male patient. Upon examination, you find a 2-inch stab wound to the inside of the right arm at the antecubital fossa. Bright red blood is spurting from the wound. The scene is safe, and the patient's responsive and alert. His airway is open, and he is breathing adequately. Do you have any other questions?
No, sir.
You may begin.
At this point, I would make sure I had my body substance isolation equipment on with gloves, Tyvek, and eye protection. Is this the only place you were hit?
Yes, sir.
All right. It appears to have an arterial bleed. Sterile dressing applied with direct pressure to control the bleeding.
Okay, the patient continues to bleed.
Okay. At that point, we'll go to elevating the extremity. Is there, he can answer meds, history, allergies.
Bleeding is not yet controlled.
Okay. Leaving that dressing in place, we grab a larger dressing, apply direct pressure still with it elevated, with the dressing on.
Direct pressure and elevation still does not control the bleeding.
Okay, at this time you would go to pressure point. So this one would be the brachial.
The bleeding is now controlled.
Okay. Would maintain that and then have somebody wrap the wound for me.
Your patient is now experiencing signs and symptoms of hypoperfusion.
Non-rebreather, O2 would be in place. I would elevate the legs. And reassess vitals.
Is there anything else you'd like to do for this patient?
Immediate transport.